Hello, everyone, and welcome to the fourth webinar in the 2023-2024 Radiation Safety and Wellness Webinar series, Sun Safety, a Dermatologist's View. We ask that during the presentation portion that the audio and video be from the presenters only. To turn on closed captions, go to More, Language and Speech, turn on live captions. Please use the chat feature for any discussions and post questions arriving from the content in the Q&A. This will help us to find your questions for the allotted Q&A portion while allowing people to have a conversation in the chat. As the webinar is only 40 minutes in length, the time may not permit for us to answer all of them during the webinar. The answers will be posted on our website along with a link to the video recording and a copy of the slides. This can be found on our website under Education Webinars. I will be sending a confirmation of attendance email after the webinar and will include a link to the page with that communication. I will also include the topics covered and the length of time spent in the webinar, as some people have requested this to send to the Professional Association. If you do not see the Q&A area, then if you type your questions in the chat, that Kim Bailey will copy them over into the Q&A. Today, we will speak to an experienced dermatologist about what she sees in her practice as a result of people's exposure to ultraviolet light and solar radiation, and get her advice for preventing this type of damage. During the first 40 minutes, we will start with a short overview of ultraviolet light and solar radiation, move to the guest interview, and have a Q&A session as time permits. The final 20 minutes was supposed to be Tai Chi with Xiaomeng Wang, as we often have, but she is not well today and unable to join us. So we will just be having the 40 minutes information session. Please note that the webinar is for information purposes only, and we will not be providing individual medical advice. If you have personal health concerns, please contact your primary or urgent care physician. We'll now have our short backgrounder in ultraviolet radiation and solar radiation. For more information on these topics, please see our June 17th, 2021 Lunch, Learn, and Dance Wellness Webinar, Ultraviolet, and our May 26, 2022 Radiation Safety and Wellness Webinar, Solar Radiation and Sun Safety at Work. Ultraviolet light is electromagnetic radiation that is not visible to the human eye. Its frequency range begins just above that of violet light, and its wavelength is just shorter than it. Its photons carry more energy than visible light. We commonly break ultraviolet radiation into three ranges in increasing photon energy: UVA, UVB, and UVC. Like all radiation, ultraviolet carries energy from one place to another. It is able to penetrate our skin to deposit energy in our living tissue. Some frequencies have enough energy to break apart bonds in our DNA or create free radicals, which are chemically reactive atoms or molecules that can damage our DNA. Therefore, certain frequencies of ultraviolet radiation are carcinogenic. Our sun is the main source of ultraviolet radiation. Luckily for life on the planet, the ozone layer of the atmosphere filters out almost all UVC. Otherwise, the surface of the Earth would be sterilized. However, most UVA and approximately 5% of UVB make it through. Humans intentionally expose themselves to UV with equipment like tanning beds and UV nail curing equipment. With this short background in place, let's move on to our guest interview. I'm pleased to welcome today's guest, Dr. Anastasia Shamsuyarova. She is a double board certified dermatologist in Canada and the US. She is serving the Northwestern Ontario community by providing dermatology services at her Eternal Springtime Dermatology Clinic and the Regional Hospital. She is also an assistant professor at the Northern Ontario School of Medicine and provides teaching to its students and residents of various specialties. Her interests are in skin cancer and advanced medical dermatology. Again, during the interview, please post any questions in the Q&A so they're easier for us to find. And if you do not see the Q&A, type them in the chat and Kim will copy them over. There were a few questions asked during registration that were outside the scope of a dermatologist practice. I'll reach out to contacts in those fields or do research online to find those answers and include them in the documentation posted to our website. If we run out of time, the answers to the questions remaining in the chat will be included there as well. Note that the doctor cannot give comment to any personal medical concerns, as these should be directed to your primary care physician. So welcome, doctor. As we can see from the introduction, you're a very busy person, and we're grateful for you for taking the time to talk to us today. So can you please give an overview of your training, experience, and your current practice?
Of course. Thank you, Lynn, for a very kind introduction. And hello, everyone, and welcome. Thank you for joining us. I'm happy to deliver this talk at the beginning of the summer. Sunny days are here finally after long Canadian winter. And as we learned now that sun can bring us joy, but also has a dark side. So let's learn together how we can enjoy the sunny days safely. I will just do a brief overview on my training. I completed 5 years of residency in dermatology at University of Toronto. I'm certified with Royal College of Physicians and Surgeons of Canada and American Academy of Dermatology in US. Certified as a dermatologist. I've been in practice for 5 years now. I worked in Guelph and Richmond Hill for the first 2 years. And in 2020, I moved to Thunder Bay, where I work in community clinic, hospital, and provide teaching for medical students and residents. We have a very large catchment area here up north.
That's great. So do you see sun-damaged skin as a dermatologist?
So in Thunder Bay and overall Northwestern Ontario, people love outdoor. Hiking, biking, fishing, hunting, skiing, farming. This is all very popular here. So, of course, it's a lot of sun exposure. Unfortunately, sun awareness became a thing probably for the last 15 years only, right? So, as a result, I do see a lot of sun-related issues. In fact, 60% of my practice, it is sun-related issues and sun damage. I see on average 150 patients a week. So it is 60 patients a week coming for me with sun-related concerns.
Wow, that's a lot. So what type of effects do you see, and what types of UV light cause, like, is it the UVA or is it the UVB that's more concerning?
I'm happy to cover these questions. And I would like to talk mainly about three issues I see, sun-related issues, which will be photo damage, non-melanoma skin cancer, and melanoma. So we'll start with photoaging. Photoaging is the big part of aging. And innumerable times I hear from my patients the question, oh, what can I use for the cream to prolong my youth? What procedures, what lasers, what peelings? And if you care about your youthful look, sun protection should be your number one, number two, and number three. And it's very important to start at younger age because studies show that the cumulative sun exposure is especially before age 12. Actually, during my residency, my training, one of our preceptors, she's a very beautiful woman, and she looks much younger her age, like 10 years younger. And not only her patients, but even us trainees, we often ask her, what's your secret? And she would jokingly say that as a child, she was a bookworm and she would spend most of her time in the library or in her room with a book versus her peers with running outside most of the time. So it was a joke, but only partially, actually, that I don't advise to lock yourself or kids in the library, but protecting from the younger age, it's an important base for youthful look. Because dermatology is very visual, I would love to share some pictures if you don't mind. Some of them might be a little bit, dramatic for an experienced person. So if you feel uncomfortable, please turn away from the screen and we can let you know when it is safe to return. So if you, Lynn, can share my presentation.
Sure.
So these are the signs of photoaging. So mainly we see increased melanin production from UVB light, and UVB, that's what increases the melanin production. It affects the top layer of the skin, and we see solar sunspots, pigmented spots, which does not help youthful look. UVA radiation, on the contrary, penetrates deeper and breaks down elastin and collagen fibers, which are important for elasticity and plumpness of the skin. So it results in formation of wrinkles and sometimes comedons. So actually adult acne, when we see deep black pads, we call it Favre-Rakushov phenomenon. So these are also sun damage. And also it can cause broken capillaries and provide this red unwanted tinge to the face. So these are the signs of photoaging. Now we move to skin cancer. I wanted to remind you that the skin cancer is the most common cancer, actually. And from non-melanoma skin cancer, there is mainly two types we see. There is a lot of them, but mainly two types we see. But before I move on to a skin cancer, I want to talk about something which precedes the skin cancer, and you can advance the slide possible. So this is actinic or solar keratosis. This has happened when mutated cells located just on the very top of the top layer of the skin, which is epidermis, and there are still good skin, or there are still good cells underneath, so it's not a skin cancer yet, but it is a precursor. They present as the small, red, scaly lesions. They are sandpaper-like. Sometimes the scale falls off, but inevitably forms again. They often on the face, on the ears, on the top of the scalp, on the forearms, all the area and hands were areas which are exposed to the sunlight. While individual lesion has a small risk to transform into skin cancer, less than 1% over a lifetime. But if the person has 5 or more of those lesions, the lifetime risk of a skin cancer, depending on the study, elevates to 10 or 20%. So if there are some actinic keratosis, it means we need to work better on sun protection. And we can advance further. So next, skin cancer, when mutated cells are actually advancing deeper to full thickness of the epidermis or invade into deeper layer, which is dermis, we call it squamous cell carcinoma. This is a cancer. It presents as the nodule, a tumor. It can have scale on the top, or it can have ulcer. It can be mushy and fungating lesion. It's often arise from pre-existing actinic keratosis, but can appear de novo as well. We can move a little bit so we can think we had enough of that.
Yeah.
So just wanted to talk about squamous cell that while oftentimes, fortunately, surgical excision is a cure, but squamous cell carcinoma has potential to spread and be deadly, depending on the tumor's characteristics and patient characteristics. So we do take squamous cell carcinoma seriously. We can advance the slide just to show this is where, if you can see, there is 3 scaly lesions, and then one of them was just actinic keratosis. These are, I circled because I did biopsy of those lesions. So, but 2 of them already was a squamous cell. So it is like a grading. Okay, we can advance the slide further. Another type of non-melanoma skin cancer, most common type, it's called basal cell carcinoma. It's a skin cancer formed from the hair follicles, and this is clearly sun-induced. It is what we call a good cancer. So fortunately, our most common skin cancer is so-called good cancer. It's called good cancer because it does not spread. Exceedingly rare it happens if it's left neglected for 15, 20 years. It presents as the shiny nodule or sometimes a scaly plaque. It can present as the ulcer, which is not healing. And most of the time, excision is the cure. There are other methods to treat it, like radiation and special chemicals, but excision is usually our number one. While it is a good cancer, it is certainly not a pleasant one to have, because excisions, since it happens mostly on the face, can happen close to the eye, close to the lips and nose. So excisions really compromise the cosmesis, and yeah, certainly best to avoid to have it. Okay,
Yes.
so we can advance. And the third, here I forgot to mention that you can see how often it happens on the ears, and this would be even, it will be very important when we talk about how we can use the sun protection. And the last sun-induced concern I see, but definitely not the least, this is Her Majesty melanoma. That's fear of patients and doctors, very deadly, very aggressive. Um, Still, with all my experience, I get amazed sometimes how this small dark spot can be such an evil thing. So a lot of those you see, actually two of those you see on the screen, the patients presented actually with metastasis in multiple organs. And then we discovered that. So it can be very dangerous. Fortunately, we do have advances in treating even advanced melanoma. And we screen and detect much earlier, and oftentimes excision, surgical excision is a cure, and patients have excellent prognosis when it is detected early, but it is still concerning as skin cancer. If we can advance further. So have little facts about melanoma. So first of all, both intense sun exposure, like a sunburn, especially second-degree sunburn, and the cumulative sun exposure, so lots of sun exposure over lifetime, even though there was no big sunburns, they both increase melanoma risk significantly. Sunburns in kids younger 12 substantially increase the risk of melanoma 15 years after the burn. Using tanning beds, according to several studies, 35% chances, it's a 35% increased risk of developing melanoma. That's why, fortunately, tanning beds are not allowed for youth right now. I would ban them from everyone, but well, so tanning beds are bad, and we have a lot of evidence about that. Um, and also for melanoma in 20 to 30% of cases develop within the mole. So it's already existing mole, benign mole or nevus, we call it medically. So number of moles predetermined genetically. However, we know and study confirm that sun exposure also increase the number of moles. So there is a lot of reasons why to keep yourself protected. And the ABCD of melanoma is really useful tool for someone who do a self-screening. And there is a lot of resources showing how to properly do a self-exam. So any mole with pigmented dark lesion, if it has those signs, which is asymmetry, meaning being not exactly perfect if you line up, right? So it's a different, there is an asymmetry. If the border is not even, but rather rugged or ill-defined, if there is variation of color, if diameter is 6 millimeter or more, unless it is a birthmark, because this is a different story, or if the mole has started to actively change, that's the reason to see your primary care provider, and they might either biopsy or refer you to a dermatology for that.
Thank you.
So this would be my overview of sun-related issues I see: photoaging, non-melanoma, and melanoma skin cancer.
Thanks. So in terms of some of the questions are ones that I thought of, some of the ones that came in from registration. So one of those, for anyone that has looked away, the photos are gone. You can come back and we're done showing those pictures for now. So is sun exposure cumulative over a day? Is 1 hour of direct sun going to burn me as much as 4 15-minute exposures with, say, an hour between each?
So it will not burn because you do have a break, and this allow the skin for repair, but the cumulative effect will be there. So if we're talking about several hours a day with multiple years, it's still going to be a cumulative effect. But yes, of course, if you do a short exposure, you will not get sunburn versus being in the sun for an hour.
Yeah, but there can still be long-term damage even with short exposures.
Yes.
Are tanning beds more or less concerning than sun life?
Yeah, as we discussed, they are bad. Not sure how they hurt with sunlight, with sunlight, but it's bad. It's bad. Many
Okay,
studies showing that.
okay. And what about some people go to get their nails done and they use UV devices to cure nail polish? Can those be a
Yes,
concern as well?
it's a very good question, and we don't have answer yet. So the exposure is short, and it's we don't know. There is no studies yet showing that, but there were done studies which looked into that. They didn't show yet increased risk, but it's, I guess it depends on also how frequently you do that, the quality of the light, because it's not standardized. I do see actually sun induced from these lamps, sun induced onycholysis. It means the nails suddenly become um, uh, they lift
Right.
up from the nail bed, they become thick and they fall off, but then grow back. This happens probably of combination chemicals and UV from the lamp. And I don't know why it happens. It's certain clients it happens, and then next time they can do it safely. But I did see the damage. But so far we don't have a significant signal. But this is something been investigated.
Yeah, and some of the lamps are only UVA and some of them are UVA and UVB. So I would imagine the ones with UVB would be more concerning.
You are more concerning,
Possible.
yes.
Yeah. So what part of the skin being damaged causes the aging and wrinkling? Like we hear a lot about skin cancer prevention, but what part of the skin and which type of UV is doing that?
Yeah. So UVA is more implicated in photoaging, and this would be a dermis, which is the second layer of the skin where collagen and elastin fibers are
Okay.
created.
So it's a little deeper in the skin then.
Yes.
Is the degree of the effect of radiation similar for light and dark skin? On the other hand, which skin color is more susceptible to the effect of radiation?
Mm, yes, of course, there is a difference. And we divide skin in six types. We call them Fitzpatrick types, from type 1 to type 6. Type 1 being very white skin, absolutely cannot tan, only burn. And type 6 is the dark skin, almost never burn. People with dark skin naturally protected from UVB light. They are DNA covered by the melanin caps, so they are more protected from skin cancer. However, they do have effect of UVA light, including photoaging, so excessive wrinkling, and a pigmentation. For everyone who has slightly darker skin knows how difficult to get rid of the mark from the scar or pimple or scratch because they tend to get pigmented. So UVA exposure make them even darker, even more harder to get rid of. So the dark skin individuals also have all the reasons to protect themselves from the UV light.
Okay, great. Are there certain populations more at risk for certain types of damage? Like I know you mentioned that young people are very at risk for certain things, but in addition to young people, are the other populations more at risk?
Yeah. So there are young people, as we mentioned, people with light skin, Fitzpatrick 1 and 2, people who are immunosuppressed due to the medication or their medical status, autoimmune conditions, rheumatologic conditions, people who take special medication which suppress their immune system for a variety of reasons, people who are taking photosensitizing medications, and you can talk with your pharmacy if one of your medication is making you more susceptible to the sun. And the biggest at risk category is organ transplant patients because they are on very heavy medication for for immunosuppression. And actually, the second most common cause of death in transplant people is squamous cell carcinoma.
Oh, wow. Are all skin cancers deadly?
So as I mentioned before in my previous presentation, fortunately, the most common one is not deadly at all. So we go from the danger one, basal cell is the best, and squamous cell is following, and then melanoma is the deadly one. There are some others which can be pretty nasty too, but that would be too advanced.
Yeah, yeah, and we have limited time, so. In terms of what types of treatments do people get for like once they have that damaged skin, the photo aging, or the other things that you had mentioned, what type of treatments do people get?
Mhm. So we have variety of treatments, fortunately. For photo damage, photo aging, and photo damage actinic solar keratosis, we can destroy the top layer of the skin by using either liquid nitrogen spray, which burns these bad cells, and hopefully the new one will come up, good one. We use the special chemicals which either kill those cells or boost your local immunity to kill the cells. These would be 5-fluorouracil or imiquimod. There are these are would be covered. These are just the services which you pay for the medication, or the treatment is covered with our Ontario, for most of the health plan around the provinces. Um, Government provided plans. There are treatments which might have a little less evidence, but we know they work, like a chemical peels, laser resurfacing, uh, photodynamic therapy. These are usually self-pay treatment, but they are very effective and give also rejuvenation effect. For the skin cancers, mostly we use radiation, sorry, surgeries. Sometimes we use radiation, and sometimes they require chemotherapy if there is a spread.
Okay. So what can we do if we do not want to age our skin, cause these blemishes, or increase our risk of skin cancer?
So using variety of methods of sun protection. We can talk about them, from skin sunscreens, skin covering, choosing your activity on a certain time of the day. There is a lot of strategies to help and to stay youthful and healthy.
Okay, and how do sunscreens work? Like as far as wearing clothing, it has to be woven enough that the sun's not getting through, or
Yeah.
using sunshades. But in terms of sunscreens, how do they work?
Mhm. So sunscreens have variety of filters which either reflect or absorb the UV light. And if you ever bought a sunscreen, you would see these letters SPF, right? So it's a sun protection factor. And what does it mean is that it means how long you can stay in the sun without sunburn. So let's say the cream with SPF 30, if you put it on one hand and not on another hand, this hand with the cream will will require 30 times longer to get burned than your cream without. But it's not as that easy actually, because in reality, when they determine these factors, it was tested with when the sunscreen applied 2 milligram per centimeter square of the skin. No one does it in real life. Even very adamant dermatology, even me, never. It's very thick. So quite a few studies showing that in reality, what we have on our skin is twice less. Actually, they did a study, and average was SPF, after applying SPF 30, your average protection is SPF 8. That's
Oh,
why that's why we need to reapply it every several hours, actually.
okay. Are all the sunscreens the same?
So they are not the same, and that's to a little bit more elaborate on the sun filters. So sun filters, there is a lot of them, and you will be happy to know that Canada has more sun filters approved than US, and actually US dermatologists do recommend Canadian sunscreens, which is we can be proud of. The sun filters varies on their protection. Some only from UVB, some only for UVA, and some can cover both. Two main categories are non-organic or mineral filters, and then organic. Oftentimes we combine them, though non-organic or mineral often are a separate thing. So non-organic are usually zinc oxide and titanium dioxide, same substances often used for diaper cream. And while they're really great and safe and they provide a broad spectrum coverage, the problem with them, they often leaves this white casting. So they're pretty pasty, and then they can leave marks on your car seat, on your clothing, not the most cosmetically appealing. Thankfully, we do have now microionized zinc, which is more transparent and more pleasant to apply. But oftentimes there is a combination. And with that, we can talk about, because this question I get a lot, what is the best sunscreen? So if you can
Yeah.
share my last slide.
Okay.
So when you choose the sunscreen, what to pay attention to, that it is, we usually don't recommend anything less than 30 for the reasons I just told you, right? That we, in reality, we never get a real written SPF. We want it to be broad spectrum. So as you can see, it's written broad spectrum, and on the top it says UVA plus UVB plus UVA. When UVA is in the circle, it means that this sunscreen has best ratio for UVB and UVA protection. It's a lot of technical details, which I don't want to go into, but actually that's the special measurement, which is provide the ideal balance, and then that it covers the long, because long spectrum of UVA is the most challenging to block. So this sunscreen is really helpful in terms of providing. And then also you can look at this record. It's unfortunately very small, but this is a means that recommended by Canadian Dermatology Association. And when it is have this label, it usually means that it is a broad spectrum, it is SPF 30 plus, it has minimal or absent perfumes, and that's important for people with sensitive skin, and this is non-comedonogenic. So if you want to I don't have any specific brands, but these are all the signs you can look for when you choose your ideal sunscreen.
Thanks so much. So I'm just trying to, I have to get back to where I was on my questions. So, as you said that you're recommending an SPF of over 30 then, and to pick a sunscreen with those features rather than just one in particular. So, because there have been a couple of questions. Now, what is the impact of sunscreen use on vitamin D production, and how big of a concern is this?
It's a very good question and valid concern. While we do get some vitamin D from the food, but it's the main source still remains the synthesis in the skin from under the induction of UV B, like UVB is needed for vitamin D. So when we block UVB to prevent sunburn, we do block that UVB, the same UVB required for vitamin D synthesis. However, let's look to the studies, and they are reassuring actually. So one of the study, and sorry, I will cite so I don't misinterpret. So one study, they did it in the spring and summer with patients, with people in whom 25% of the body was uncovered, so hands, face, neck, and arms, and they were exposed to the sun in the midday, and actually 8 to 10 minutes was enough to produce the daily dose of required daily dose of vitamin D. That required 2 hours in the winter. So it is challenging in the winter. Then another study in Greece, they studied children, and they measured their vitamin D levels throughout 13 months. And those were children who were using the sunscreen. And there was no decrease in vitamin D levels apart of just a drop in January. Seems like use of the sunscreen did not prevent that. There's multiple consensus group were formed between nutritiologists, endocrinologists, dermatologists together. And because we do have supplementation, and there is a recommended supplement to take for everyone, basically, and we never use sunscreen good enough, I think this is a little concern for average person. There are some people at risk who are truly not exposed to light because they are bed bound, or they are really have to be super protective because there are some skin conditions where sun absolutely contraindicated can cause significant effects. So those individuals can be at risk. They do require monitoring and excessive supplementation with vitamin D.
Thanks. What's the biggest errors people make with respect to sun protection?
Yeah, using not enough. With that though, if you don't mind, I would like to stop on safety on sunscreen, because this is a big issue and there's a lot of controversy about safety. absorption of the sunscreen, and some people actually are reluctant to use the sunscreen because of the safety concerns. And there's quite a few studies done for that as well, and including one which is FDA study, and they use the organic chemical sunscreen, and they showed that there is an absorption. However, we need to look how they've done it. So the person would apply basically a bottle of a sunscreen on 75% of their body on the day one. And on the second day, they would use, again, on 75% of the body, pretty thick layer of sunscreen every 4 hours. So for 4 consecutive days like that. And then they saw an absorption. So in reality, again, another study shows that average person use 1 bottle of a sunscreen in a year. So because we clearly see risks of sun, we see consequence of unprotected sun exposure, and we don't know yet about absorption of the sunscreen. I think this risk benefit decision is easy. I would suggest, though, for patients who are, for people who are extremely cautious, to choose mineral sunscreen. Mineral sunscreen, zinc oxide, titanium dioxide, showed no absorption, absolutely. Even microionized or microionized transparent zinc does not show absorption. So if you really risk averse and you would like to be careful, that would be your choice for your kids.
Yeah, and sometimes it's a little difficult to find them, but you can find them if you have to read all the ingredients and look for those 2 minerals. So there were a few questions that were a bit more technical in nature. Our audience is often people that have a background in radiation protection. So from radiation therapy perspective, what would be advised when talking to patients while on treatment for sun protection, if they have some sort of therapy or medicine that is going to make them photosensitive?
Mm-hmm. So for radiation therapy usually results in radiational dermatitis, meaning that the skin will be damaged and it will require some time to recover. And at this time when the skin is vulnerable, especially sun protection is important, not only because of the effects of the UV light would be significant, but also the healing. It can really result in post-inflammatory pigmentation, what's so called. So this healing might be delayed and not good cosmetically. Radiational dermatitis can often be dramatic and with erosions and open skin. So at this point, it would be hard to use sunscreen, right? So I would suggest covering with SPF clothing or a dressing or Band-Aid. And once the skin healed, open areas healed again, dermatitis skin is more prone to absorption. So probably mineral sunscreen would be the best choice in this case.
Okay, great. And then up to what surface area level and for how long can such skin exposure contribute to the occurrence of erythema and melanoma?
Mm-hmm. So that's a challenging question just because it's a little bit different, right? Erythema happens with minimal erythemal dose, and it depends on your skin type, depends on the intensity of the sunlight. It will be very different from in the morning than in the midday, very different for very light skin individual to a dark skin individual. Melanoma more a consequence, and that's why much delayed. We don't have exactly, of course, we don't have exactly the dosage, and plus it's so many factors. So some might have million sunburns and fortunately never develop that, but the risk of them to develop them is much higher. So yeah, we probably don't know those exact numbers.
Yeah, and for any, like when we're talking about radiation effects, that we have these 2 different classes of deterministic effects or tissue effects, and then we have the stochastic effects such as cancer. And with the thresholds, those vary, as you said, from person to person, depending on many different factors. So when I'm looking, I'll try to find some papers on that topic to include to respect that person's question as well, but it depends is the answer. All right. So with that, that is the end of the formal questions that we had prepared. So what we're going to do now is I haven't been following the chat or the Q&A. I'm going to see what's there. But if we have time, I'm taking a look at the time. We're pretty much, we might take 5 extra minutes of your time if you don't mind, Doctor, and see what's out there. So I'm just going to, there's a question here that says, so a periodic chemical peel can help reduce skin cancer or damaged cells? Or was that just for the aging?
Yes, as I mentioned, that can this can improve the existing sun damage. So if you do have existing photo aging and sun damage, including the actinic solar keratosis, it can prevent. There is no evidence there is no firm evidence on that, but it will, but it will do nothing without proper sun protection.
Okay.
So
You
don't
have to-
forget that after chemical peels, you're more susceptible to effects of UV light. So it needs to be a very
So it has
needs
to
to
be,
be very
you have to then change your habits, whatever
yes.
led you to that damage. Does expired sunscreen diminish its effectiveness for protection?
Yes, expired sunscreen, and not only expired sunscreen kept in a hot car, sunscreen kept in some other warm conditions under the pressure, under too much shake, unfortunately can decrease. Yeah, they can degrade. The SPF factor can degrade. I would recommend to have a good sunscreen and think about the care. We all leave them in the car sometimes, right? And just do replacing. If you felt it's super hot, probably good idea to replace.
Another question is, I haven't found any lip balms with greater than SPF 15. Do you know of any, and are they needed?
I usually I advise 30 indeed. I remember sometimes online. Yes, I know it is a challenge. It is a challenge to get the lip balm, and it is important to protect the lips. We do see actinic cheilitis, and skin cancer on the lip is actually a high risk skin cancer, squamous cell carcinoma. Aven might have it. It's a brand, and online. Sometimes online it's easier to find. And there are certain at the doctor's office, sometimes they sell this medically graded cosmetics, which are only available through distributors for the doctors. So this one to check. But yes, but even if anything to choose, 15 is already good. It's better than nothing.
Better than nothing. We had already talked about mineral versus chemical sunscreens a little bit, so I'm going to skip over that just because of time. Do you know the ingredient in sunscreen that people are often sensitive or allergic to? Are there any ingredients to watch out
Yes,
for?
it's a benzophenone 3 or oxybenzone. That's the most common filter which cause allergic contact dermatitis and photoallergic contact dermatitis. But there are some others, and not only filters. So because sunscreens have regular preservatives and fragrances, so but from all the filters, benzophenone 3 or oxybenzone, that's the notorious one.
Okay. Are UV rays weakened when traveling through windows?
So windows block 90% of UVB, so you cannot get your vitamin D through the window, but it's only 70% or less blockage of UVA, including the car window, unless you treat them with a special film. So that's also important. If you're driving a lot, don't forget to put the sunscreen as well, because UVA, which induce aging, will be there. Or you can ask your dealer to clarify if they had a treatment or some. It can be done. I believe it's not that overly expensive.
Okay, and I don't know, are you okay? There's 2 left. Is it okay to ask those 2? Okay. And now I'll try to pronounce this correctly. So you mentioned actinic keratosis. Is seborrheic keratosis a precursor to melanoma?
Mhm. So so just to clarify, there are 2 types of very common keratosis: actinic keratosis it's a precursor of squamous cell carcinoma, but not melanoma. Only squamous cell. It can transition into squamous cell. Seborrheic keratosis, which presents differently, it's totally benign lesion. It's a age-related lesion, not sun-related. It's genetically predetermined how much you will have them, how many you will have them. We all get at least one by age 60, and they don't turn into skin cancer at all. So if you want to Google pictures, actinic keratosis and seborrheic keratosis, they do look quite differently. There are some confusing moments sometimes, but usually family doctors are really good at distinguishing these two. So if you have question, you can double check with your primary care provider.
Thanks. Are freckles in children or adults always indicative of skin damage? Okay, so
I mean,
someone has
some are born with lots of freckles, but yes, they are definitely more related. So we all notice how many more freckles we get in the summer. And I used to be super freckly in the summer, and since I started to use sunscreens, prudent, I do have very, very few.
Okay, well, thank you so much. I'm just going to go back over to the deck
There was a
itself.
question for the teenager, how to encourage the teenager, right?
Oh,
It
okay,
says,
that's in the
I
chat.
just
Okay,
I noted.
okay,
Yes, I
okay,
just
sure.
noted because and this is I wish I'd have a good answer. I think talking about photo aging, probably young people will not buy your skin cancer at 60. But melanoma we definitely can bring up because it can happen. It usually happens in young people. But photo aging, that would be important. Maybe showing some pictures, sometimes again, teenagers. And then to make it a routine. So that's why we recommend sunscreen day or rain or shine to become a routine. So brushing your teeth, put your sunscreen and keep it on the shelf and remind at first, but it has to become a habit.
Yeah, and there are specialized ones for, to put on your face and things, so at least if that's protected, that's a start. So it's if people do moisturize, it's like put your moisturizer, put your sunscreen on kind of thing.
Yes.
Yeah, no. Sorry, I'd missed that in chat because I was over at the Q&A. But we really do appreciate. I'm just trying to get back. I need about 3 monitors. So that's all the time. So there was a question about whether there's a certificate for coming. What I do is I send out an email that outlines the guest. It gives more information than just a certificate. So I will send those out for everybody once the video is processed, and that will probably by the end of the week. Since it's Monday, I'll probably have it done by then. So thank you again, Doctor, for taking time out of your busy schedule to share your knowledge on this important safety topic. And for everyone that joined, we hope that you found this webinar on sun safety informative. It's really important, I think, to hear from people that see those effects day to day. Because we might know, like I know several people that have had skin cancers or things like that, but I think when the volume of which and the photo aging and everything that we don't often think about, it's easy to put it at back of mind. So with that, if you have any questions about any radiation safety topic, please feel free to contact us at the Radiation Safety Institute of Canada. We have a toll-free information service to support questions from employers, workers, and the public with respect to both ionizing and non-ionizing radiation safety. We also provide consulting services for those who might need support in developing a radiation protection program and related services, including radiation surveys. So if you have any further questions, then contact us toll free at 1-800-263-5803 or by email at info@radiationsafety.ca. You can also visit us on the web at www.radiationsafety.ca and find us on Facebook, LinkedIn, and YouTube. So with that, we will say goodbye to the good doctor. Again, that Charmaine Wong is not feeling well today, so we won't be having the Tai Chi today, but hopefully she or we'll have another activity at our next webinar, which is probably going to be next week. But so thank you, Dr. Shamsuyarova.
Thank you, and enjoy sun safe summer. Thank you. Bye.
See you, everyone.